Hi, today's video is going to be talking about telltale signs of flare-ups. This has been a request by some patients and is quite a commonly asked question. My name is Ali. I'm one of the physios from treatmyachilles.com. We're an online virtual physiotherapy service treating all kinds of Achilles problems. If you would like to find out any more information or how to book an appointment, please see the information below. So today we're going to be talking about telltale signs of flare-ups. So this relates to Achilles tendonitis, tendinosis, tendinopathy. We're using those terms interchangeably. Flare-ups can be quite common with these types of conditions, and what you're noticing then is a sign that your tendon is just not happy with the amount of activity or the amount of load that you're putting through that tissue. When you're putting that load through, your Achilles is saying to you, I can't cope with this, I'm not robust enough to manage this a little bit, so it shouts at you to let you know that this is happening. Typically, this then causes you to not be able to do those activities. So you've gone from doing something and making it sore to stopping and having to rest. And then as you rest and stop doing those level of activity on that tendon, things start to feel a little bit more comfortable. So then you can go back to that activity again and that cycle repeats. So that's called a boom and bust cycle, and it's really, really common with Achilles tendinopathy patients, and it's what we hear if they've been having problems with this over a period of months to years or even weeks, where people are saying, oh, I've had to rest and I can go back, and then it flares up again, and it's quite a typical pattern. So yes, it's really common, but it also doesn't mean that there's a sign that something is getting worse in that tissue, in that tendon itself. It is to remember that this pain is more like an alarm system that's shouting at you and telling you about it, as opposed to indicating how much damage or how much tissue change is going on in there. It's not also an indication about how long things might take to get better or how severe things are. It literally is just an alarm shouting at you. So how do you tell whether you're at risk of a flare-up or whether there's one maybe bubbling around on the horizon somewhere? Well, there are a few telltale signs to look for. One is that boom and bust cycle. Have you got a history of doing that? Look back, see whether that's something you can recognise yourself, or you may have data from things like activity watches or Garmin's or from Strava or anything where you've taken notes and written them down in a notebook. When you're looking at those sorts of different things, you may notice that there's been weeks where your mileage or your elevation is suddenly high, and then weeks where the amount of activity in minutes has had to drop, or whatever it is that you're using to measure. So if you're in a boom and bust cycle, that's one side to thinking, oh, there could be another flare on the horizon. The second is to look at what your pain levels have been like. So if you were to look at what an acceptable level of pain is, and we have an article on that, and what we're looking at with that is that your pain is sitting around a 0, 1, maybe 2, maybe outside bet 3 out of 10. So if I quantify that, that means that you can do your activity, you can then do whatever you wanted to do for the rest of that 24 hours. You're not worsening your symptoms, and typically with a tendon there tends to be a latent reaction, so it might feel a little bit sore to start, warm up and go away, and then that pain comes back a bit later. Or you might notice that it's after you've sat down later that day and then go to get back up again, or typically it can be right over to the next day where you've got more pain, or first thing in the morning where you get out of bed, there's more of that stiffness, walking like a 90-year-old type feeling. So if you were to try and keep your pain at that 0, 1, 2, 3 level, that means everything's staying pretty consistent and you can keep your activity level around that point. So if your pain isn't staying around that level, and if you were to look back to last week compared to this week, and you're living a little bit more in that background pain, so it was 1-ish, now it's creeping up to 2-ish, or it lasted 15 minutes in the morning and now it's lasting 20 minutes in the morning, we've got a bit of an idea we're on a slippery slope where your Achilles is starting to shout at you to say, hey, I'm still here, think about me a little bit. So looking at your pain tolerance over a 24-hour period, looking at it week on week to see whether it's deteriorating is a really good trick to see whether you're getting any decrease or increase in symptoms and decrease in function. So decrease in function is our third thing. So you may be thinking, okay, I can do what I want to do, this is all good, but my function isn't quite right. So what do I mean by that? It means that you might be able to run, but you're just not running as fast. It might mean that you're able to move and do the sports and activities that you like, but you're having to adapt or change the style in which you are moving. Or you're saying, okay, I won't do that in training today or in my gym class today, I'll do something instead of that. It may be that you're typically noticing with an Achilles tendinopathy that's involved in that push off on your toe, so that pushing off to move. So anything where there's jumping or hopping or any kind of performance that's related to those sort of speed ballistic work, that again, that power or that ability to jump or hop has decreased. So that's another marker on a telltale sign. Another typical type of thing we might see if somebody's about to have a flare up is that too quick, too soon. So what have you instigated in the last weeks, days, or even up to the last month or so, which has suddenly meant that you were doing this amount of activity that has jumped higher than that. So it could be that you've had a layoff because you've been poorly or on holiday and you've suddenly gone back to your previous activity. Or it might be that you've decided to, let's use running as an example, just keep going with the amount of mileage you were doing, but suddenly start doing hill reps and you've done an awful lot of those. Or you've started a new different type of activity that you've put in top of or on top of the training and the sports and activities you were doing. Maybe it's not related to sport and activity and it's related to time on feet. So have you started a new job? Have you changed footwear? So for example, summer's here and you're wearing more flip-flops. So therefore you're having to use your feet slightly differently compared to if you were wearing more formal shoes or trainers. Anything where there's been that sudden increase in a change in load, again, it might not be an immediate response, it might take a few days to weeks to build up to that, but anything where you're seeing that in your pattern is also an indication that there could be a flare-up on the horizon. One other thing to consider with this is looking at whether your weekly pattern of how you're doing activity, you've got no real rest days. And again, this is a bit of a sign that an overuse injury, an overuse is an injury that's happened without an accident or an incident, is on the horizon. Might not happen, but it's something that we would look at in people's training schedules and encourage rest days to be put in. So what to do about a flare-up? We've got some wonderful articles and videos out there already describing how to handle painful flare-ups, why flare-ups aren't always a bad thing, and also talking about those things we've spoken just in this video, boom and bust cycles, the importance of rest, the too much too soon type training errors that we may well see with people. So if you would like to look at each of those different components, that will give you all of the information. In a nutshell, what we need to do is calm it down and build it back up. So what can we do to settle things down to that 0 to 1, 2, 3 out of 10? Would that be editing the amount of activity that you're doing, which may not mean stopping completely? Would it mean using things like potentially ice, potentially anti-inflammatories? And again, we've got some nice articles on whether to use heat or ice, or when anti-inflammatories are good to be used and not to be used. And again, they're typically not great in Achilles tendonitis and tendinopathy. The anti-inflammatories, they tend to be more maybe for a bursitis issue. So a bursitis would be looking at where that Achilles attaches into the bone and if there's irritation and possibly swelling and a change in size around that area. And again, there's lots of articles on that. Once you've calmed it down, you might be using things to help with that, like heel raises inside of shoes to lift your heel. It may be modifying your exercises that you've been given to help with your Achilles tendinopathy. So you might be lowering the amount of weight you're holding, decreasing the repetitions, doing them little and often instead of in one big lump. It depends on you, and that's where you'd want to speak to a practitioner to help you with that. Once you've done that, it typically takes maybe 3 to 10 days, up to 2 weeks to kind of settle, depending on what your normal symptoms are and how long things take to you. We can start building that activity back up again. And it's about avoiding those pitfalls of that boom and bust or going too quickly into it, and also building back into those rehab exercises slowly and carefully. Over time, those rehabilitation exercises will make that tendon more robust so you can do more before a flare-up. So we would be typically noting that you would have longer periods without a flare-up, so flare-ups would be fewer and further between. It may be less intense if you get a flare-up, or that flare-up takes less time to calm back down again because you've made things more robust and you're more aware about what to do. If you recognise any of these symptoms in yourself, it may be worth booking an appointment so we can make this an individualised approach.